Hello and welcome to the Collapse Life podcast. I'm your host, Zara Sethna. Joining us today is researcher and author James Roguski. James is an activist who, like us, believes old systems are crumbling and need to be rebuilt. Last year, he uncovered documents from the World Health Organization regarding proposed amendments to something called the International Health Regulations. His activism has been instrumental in raising awareness about exactly what's going on at the WHO and the hidden agendas we're not supposed to know about. James, welcome to the podcast.
Oh, thanks for having me. I appreciate it.
So, you have certainly become well known in at least some parts of the internet these days for the work that you've been doing, uncovering and exposing the WHO. But first, I just wanted to start just with a little bit about you and what were you doing before COVID? I know you wrote a book in 2005 called Your Doctor is a Liar. So obviously, you've been suspicious of big pharma and the medical industrial complex for a little while. So just tell us about your background.
Well, in your background, there's a little piece of antique furniture slash bookshelf. What I was actually doing, to pay the bills was rescuing abandoned furniture and repairing it and reselling it. And a lot of people were heading out of Los Angeles, so a lot of people were just getting rid of stuff, and we're saving a lot of beautiful things from the landfill. Uh, but I think you were looking more along the lines of, how was I, dealing with all of this information? Uh, Immediately before what happened, when I found all this with the WHO, I was publishing many, many articles, and I'm sorry, many, many websites in regards to COVID and many other things health related. For 15 years, I worked as a manager and a buyer for a couple of mom and pop urban nutrition stores. So I've been way down this rabbit hole for about half my life. And I got an email one morning from my web hosting company that I'd been with for a decade or more. And they gave me like a day and a half notice, and then everything was gone. And I was like, okay, now what? So I ended up on Substack, which has been very good so far. Fingers crossed. I get to say whatever I want to say because, I was never told what it was that triggered my removal of everything that I'd worked for a decade from the internet. But I suspect it was an article that I wrote about Run Death is Near, which is my nickname for remdesivir. I learned in February of 2022 that, well, actually, it happened a little bit before in January. I wrote a couple of articles in February. When I learned that they had authorized the outpatient use of injectable remdesivir in infants, my head just went ballistic. I was just like, you have got to be kidding me. And so when I posted a couple articles about that on my other websites, and then they were gone. And so, okay, kind of, I was very happy with myself. It's like, all right, I guess this opens up a new chapter in my life. What am I going to do now? I had all this stuff. I could have rebuilt 10 years worth of work, but I decided to go forward. And so I ended up on Substack, started digging into a lot of proposals that really started because of what happened in November and December. And we'll talk about that a little bit maybe. But events had happened a couple of months prior, and there was this push to have a what everyone calls a pandemic treaty, but that is just really not the right thing to call it, even though everybody does. So, but at the time, I didn't really understand that because it was very vague. There were a lot of proposals. And so I wrote a monstrous article about all of these proposals called the Pandemic Treaty back on uh, March 24th, 2022. And the next day, I got to thinking, I was like, well, if they want to try to change international law and create a new treaty, I've got some ideas for them. So I wrote thepeoplestreaty.com and I published that the next day. You can go to thepeoplestreaty.com and see what I was thinking, a year and a half ago. And I got awakened at 4 in the morning one day on 3 or 4 days later, March 28th. And I was just compelled to go search on something on the internet, which was not unusual, but I don't normally get dragged out of bed at 4 in the morning. And I found a blog and it said, oh, we've obtained this document. And so I'm curious. I clicked on the hyperlink, and little did I know that that was the portal to all things WHO, because what that document was amendments to the international health regulations, totally different thing than any kind of new treaty that the Biden administration had quietly proposed back in January of 2022. So it was hidden very well in plain sight, kind of, for 2 months. I found it, I started reading it, and I knew what the international health regulations were because what I had been researching. But I was like, oh, wait a minute. This is not the treaty. This is something totally different. And to this day, everybody has problems separating these negotiations for a new agreement, which is not a treaty. They call it that. Um, everybody calls it that, but the WHO doesn't. They call it a convention agreement
Mm.
because in Article 19 of the WHO Constitution, they're empowered to negotiate and come to a convention agreement. And so I'll stop there because that's how I got started. And where do you want to go from there? Because there's a lot of stuff.
Yeah, it's very complex and there are a lot of threads to pull there. And I hope that we can pull most of them. But I think the first place to start is to just talk a little bit about what is this body, the World Health Organization. I think for a lot of people before COVID, they probably never heard of it or they heard of it sort of in their peripheral vision. There's this big international organization that's meant to do good. It's kind of innocuous. And then the pandemic hit. And I think now probably everyone has at least heard about it, but I'm
Mhm.
really not sure people understand what it is, what it does. So, you've been researching this now over a year. Can you help us understand where does the organization come from and what was it established to do?
I'll go back to before the Civil War. Okay. Imagine a time where the mode of transportation was probably a horse. Okay. You didn't have indoor plumbing, so maybe you had a latrine or an outhouse outside, or if you lived in a city, maybe you had a chamber pot. And if you had to um, relieve yourself, you did it in a chamber pot, and at some point you threw it out into the street or out into the field or wherever. And so sanitation was an enormous problem. If you live downstream from Paris, okay, ugh, or London, right? The water supplies were all contaminated with excrement, and so there were sanitary regulations that were written in the 1800s and into the 1900s. By the time you get to World War II, they had done a decent job, indoor plumbing. The automobile replaced, animal transportation, so the streets weren't filled with excrement, and infectious disease rates plummeted. And so the WHO inherited these sanitary regulations after the war. The United States joined, not through a treaty, but through a joint resolution of Congress signed by Harry Truman on June 14th, 1948. And that document is both problematic and interesting at the same time. It says in there that we're joining the WHO, but nothing that they do has any force or obligation on us. Happy to help out. We can help with our expertise and resources and money, and they can give advice, their expert advice, whatever. But there's nothing binding about it, and arguably that's okay. But, these things are slippery. And so the WHO Constitution that we agreed to when we became members has some interesting statements in there where it says that they're in charge of, all the health things in the world and they can do pretty much anything they need to do to make that happen, to have everybody be healthy. And so there's a little bit of this conflict in there because go all the way back to the United States Constitution. What people forget what the Constitution was, and they get confused about what it really is. It doesn't really protect our rights. The Bill of Rights do that. The Constitution is where the states gave very specific powers to the federal government, 18 enumerated powers, and control over health or healthcare ain't one of them. And a couple of months ago, Javier Becerra, who is the secretary of the Department of Health and Human Services, was interviewed, and they asked him, "What would you like Americans to know about the Department of Health and Human Services?" And he didn't skip a beat. He said, "Oh, People need to understand that the federal government does not have any authority over healthcare. Then he went on to say, but we do put a lot of money into it. And people respond to the financial benefits of what the federal government's doing. And so that is something that everybody needs to keep in mind. And even on a state level, the authority to control your body is assumed by many people, that the state or the federal government have authority. No, they don't. It's all an illusion. And so when we joined the WHO, maybe if there was a constitutional amendment that went through that proper process, and we said, oh, okay, great, we'll put the WHO in charge of our health. Well, we certainly didn't do that. And so it's an advisory organization that has an opinion.
Mhm.
And so you had said something, how people come to interact with the WHO. After I had been digging into this for like a year, I got an email because we had ordered something and it wasn't shipped to the home. It was shipped to a local pickup location, during COVID lockdowns and all that craziness. And my girlfriend points it out to me because it was a tracking thing and it had a little note in it because she knew it would really get me. There was a note that said, "Oh, when you come to the pickup location, please wear a mask and all sorts of." And it was from the WHO's
Hmm.
recommendations. And so she knew it would make me laugh because most people would have seen that and go, "Ooh, ooh, I got to do what they tell me to do." It's like, no, it's a recommendation. And I call them the World Hypnosis Organization because people fall for their suggestions.
It sounds very authoritative, obviously. So I think without that deeper understanding, people could easily think, well,
Mhm,
we have to do what they say.
mhm,
I think that leads really to the next question that I have, which is a little bit about the structure of the organization, but especially about its funding structure at this point. So, my understanding is that member states that join these UN organizations pay dues, and that is how the organization gets funded. But more recently, there are a lot of private funders as well, or other organizations that fund the WHO or UNICEF or other UN agencies that are themselves made up of private funders and other agencies. So, the United States and the Bill Gates Foundation and Gavi, the vaccine initiative, all fund the WHO. But then Gavi is funded by the United States and the Gates Foundation and UNICEF. And UNICEF is funded by the United States and the Gates Foundation. So can you just talk a little bit about how this happens and also the implication of that?
It's hard to talk a little bit about that. You
Sure.
could go on for days. So I heard two questions in there. The structure of the WHO, very good question, very important, and how they get their money and how they operate. And so the World Health Assembly, which is the delegates from the 196 member nations, meets once a year, and they are the governing body of the WHO. Kind of like if the Senate was in charge of the United States.
Okay.
Okay. And so, yes, they have a director general to, oversee the bureaucracy and the implementation, but the decisions and the policies are governed by the 194 member nations. Now, much like the Senate, each nation gets one vote. And so, highly populated countries like China or India, a billion and a half people, one vote. United States, 300 and some million people, Nigeria, Indonesia, Brazil, Japan, huge populations, one vote. Pick your tiniest island nation or smallest, economy in Africa, one vote, right? And so jumping ahead a little bit, all of the things that are being talked about with these amendments to international health regulations, a simple majority, 99 little tiny nations getting together, and it's 99 because with the international health regulations, Liechtenstein and the Vatican are party to the international health regulations. And so some nations have not paid their dues, so they might not get to vote. So the safe number to wrap up in your head is if 99 little tiny nations submit amendments to the international health regulations, there wouldn't be any way to stop it. Okay, there's no veto power. There's no second, House of Representatives. That if 99 nations get together, simple majority, and it could be a little bit fewer, if some nations don't vote and so forth. But that is the structure of how policy is supposed to be set in the WHO. Now, where the money comes from originally was, well, if you have a big economy, you pay a certain amount of money. If you have a smaller, middle-sized economy, you pay a little bit less. Tiny little economy, you pay where it is. And so about 20 years ago, the nations kind of weren't happy with what was going on with the WHO, and they didn't really want to pay more. They because they have to approve if they're going to pay more. And recently they did do that, and the numbers are going to start going up. But what has crept in over the past 20 years, you already alluded to, is voluntary contributions. Now, a lot of people don't look at the numbers and they look at old numbers and they make a lot of statements. I published an article back in May of, actually, maybe it was April or May of 2023, where they had all the numbers for last year. And 84% or so of all of the money that comes to the WHO was additional donations. So the assessed dues are really kind of small. I think the United States pays a couple of hundred million, which is a lot of money for you or me, but in the grand scheme of things, it's not very much. I was looking this up the other day with a friend because they had asked me about it, and I chose the nation, the Central African Republic.
Mm.
Their dues were less than $5,000. And so, okay, great, that's not bad for membership in this, club. Well, the motivation to be a member, number one, you have a vote, beyond your position in the world. But, if you're going to be receiving maybe, tens or hundreds of millions of dollars in investment in your economy to do whatever it is the WHO wants to do to you in your country, that $5,000, assessed dues is probably a pretty good, you get a good return on investment. And so the influence of money has shifted to where foundations and corporations, but actually more importantly, nations. The United States had to pay a couple of hundred million, but they gave an additional $750 million. And those extra donations from countries are earmarked or have strings attached. Oh, well, we're going to give you all this money, but here's what we want you to do with it. And so the WHO is at the beck and call of whoever's donating this money with strings attached. I I I, I have to do the math really quick in my head. I don't think their assessed dues even pay like the fundamental operating costs because 30% of their $3.8 billion budget in 2022 went to salaries. They had 8,851 employees earning an average of $120,000 a year. They spent $1 billion a year on salaries, maybe half a billion on actually medical supplies and products. And so, what are they? They're a bureaucracy.
So yourself and Dr. Merle Nass and Robert F. Kennedy Jr., you've all been calling a lot of attention in the past year or two to the World Health Organization and what they're trying to do. And I think RFK Jr. has sort of classified it as a power grab. Um, and so, for people who are listening, there's this sense that this is a corrupt bureaucracy, an agency that's not got our best interests at heart. So, I want to kind of go down that rabbit hole a little bit and talk a little bit about what is happening and why you're so concerned. But then come up a little bit for Aaron and say, is there anything good coming out of this effort, this coordinated global effort, or not? Maybe we'll see.
Well, just for clarification, I work pretty closely with Meryl Nass. We've collaborated. It's mostly her effort, but I've helped out with doortofreedom.org. And I don't have any connection to the Kennedy campaign. And I think you might have merged some of the things Meryl and I have said. I'll let Robert F. Kennedy Jr. speak for himself about the
Okay.
WHO.
Okay.
In terms of the question, if I could ask for a clarification, are we talking about all of these negotiations? The what's going forward? Okay. First and foremost, at this moment in time, We are in limbo, and I'll try to explain why, and I'll talk about three separate things, if I may. I'll take the most limbo situation first. A couple of weeks ago, the Intergovernmental Negotiating Body, which is the group that is overseeing the negotiations towards the WHO CA plus, which most people mistakenly call a treaty, they've been having problems. They had a initial draft back in July of 2022. They had a conceptual zero draft in November. They had a zero draft in February, and then in April it hit a snag. And they were basically arguing the air in the room in these video recorded meetings of some of the things that they did show. You could just cut the tension with a knife. And so what they said was, okay, to all the nations, by April 22nd, please submit whatever text you would want to have in this convention agreement. So they did. And there is a rumor, it's a really good, pretty well founded rumor, that there exists somewhere on the planet a 208-page compilation text of all of the submissions that all of the nations made. It's been invisible. You can't find it. If anybody has one, send it to me. You'll be my best buddy. They've kept it completely secret. What they did was the bureau or the bureaucracy that's operating and running the negotiations cherry picked 43 pages and came out with the bureau's draft. And so, if you can just do the subtraction, 208 minus 43, there's a lot of information that didn't make the cut. And the nations that didn't have their information put into this document are not happy about it. And they've pushed back. It's all hush hush quiet. They don't want to have anybody know that they're not getting along. But a couple of weeks ago, they said, but we're going to throw that one away too, and we'll come back with the negotiating text. Um, October 16th is when they said they would circulate the um, private English version, and then maybe for Halloween we'll get a trick or a treat with the formally published new WHO CA plus. So at this point, I'd be more than happy to talk about all of the stuff that was in the old versions, but I'm working really hard to erase my mind from the things that they had done because that's how negotiations are. So a new version is coming out. We shall see it when we see it. The issue from the last version that I think is the most important thing is chapter 3, and it's a framework convention. It's not a treaty the way people think of treaties, where you put a bunch of words on paper, you agree to it, you sign off on it, and that's what it is. A convention is very much like if you had a contract that you were signing with somebody, and they took, a half a ream of blank paper and they stuck it into the contract, stapled it all up, and they said, you know what, we'll have our people fill in the details later. Just go right ahead and sign on the dotted line. Come on, world. Don't do that. That's crazy. I mean, you don't really need to know what the details are because the details aren't there. The details would be determined in the future, not by you. I mean, signing a blank contract, signing a blank check is insane, but it's not without precedent. In 1992, all of the nations of the United Nations signed the Framework Convention on Climate Change. And so, how's that working out for you? Right? People wonder why is all this crazy stuff going on? Why are they doing all these crazy things? Well, you signed a blank agreement 30 years ago or whatever, and somebody else is adding pages to the agreement, and you got nothing to say about it. It's crazy.
So, what kinds of things are in this convention? And you mentioned chapter 3, so we have to go there and figure out what's in it. What
Well,
are the kinds of topics that this convention agreement would cover?
it's in limbo. Okay, so I can talk about the latest version, which is the bureau's draft. Um, but we don't know what was in the 208-page compilation text. Okay. Now, essentially, in my interpretation, and everybody can have a different opinion, it's got nothing really to do with health. My read on it is it's a venture capital prospectus to transfer wealth from wealthy nations to the relatively poor nations to build out what the United States Defense Department would call the global health security agenda. It's not health, it's global health security. When I hear that phrase, I think bioweapons. I
Right.
think laboratories. I hear the agenda to just seek, one health approach to looking for pathogens everywhere you possibly can find a pathogen with pandemic potential. Bring that back into this WHO organized laboratory network, identify it, and they have what they call a pathogen access and benefit sharing system. Now, what that means is nations feel that if they identify a pathogen, that's actually a national treasure. It's a resource, it's intellectual property. Go all the way back to the Convention for Biological Diversity. Native cultures who understand herbalism and healing herbs, they wanted to protect themselves from pharmaceutical companies coming in and stealing that knowledge and profiting from it. Well, look at what happened when South Africa and or Botswana a couple of years ago said, "Oh, we found something. We're going to call that the Omicron variant." They alerted the world, and they were whacked with travel restrictions, hurt their economy, not treated fairly by any stretch of the imagination. And Pfizer and Moderna took that information, turned it into boosters, and made a whole bunch of money off of it. These negotiations are arguing about equity. When what happened in 2021 was when the injections rolled out, they were supposed to go worldwide to frontline workers, doctors, nurses, that kind of thing, and maybe elderly or anyone else who was deemed to be the most highest risk. And that's not what happened. What happened was the United States and Canada and Europe and UK and Australia, New Zealand, they bought up all that they can buy up, and there wasn't really enough to go along. There was a delay in getting the jabs, and at the end of 2021, all the nations called for a second assembly meeting, World Health Assembly, and the net takeaway from that was a declaration that they need a legally binding agreement to ensure equity. They didn't say anything about making sure people around the world are healthy, right? They want to make sure that the rich nations don't hoard all of the products that might be life saving and don't make all the money from it. They want investment in their nations to build all the factories and all the laboratories and all the testing and facilities and healthcare, all that sort of stuff. They want money to build out what I call the pharmaceutical hospital emergency industrial complex. These negotiations are not about what happened over the past 4 years. They're not addressing any of the mistakes and the crimes that were committed. They're not doing anything. When I talk a little bit more about the amendments, there are things that they should be negotiating to fix the problems that we dealt with the last, and they're just not doing that. They're arguing over money, intellectual property, pathogen access, and benefit sharing. It really should be negotiated in the World Trade Organization because it's not about health. That's a facade.
That's really interesting. So, um, I know that there's a difference between this convention agreement and the international health regulations. And then there's also a term that's thrown around a lot, the pandemic treaty, which I think you've already touched on, but maybe we can just clarify. I think some people understand that this pandemic treaty, if it were to go ahead, would mean that sovereign nations would not be able to decide for themselves when to initiate a lockdown or when to mandate vaccines or things like that. And I'm not sure that that's necessarily correct. So
It's,
that's what I'm
it's
hoping.
not correct, and I'll address that head
Okay,
on.
great.
There are all these many documents, and there were proposals that had been sitting around for a year being negotiated. So at this point in time, we're in limbo. And what's in the WHO CA plus, none of that, right? Everybody gets it all confused. Some of those ideas are in the originally submitted amendments in this big pile that are currently being negotiated. But what's in the WHO CA plus, which is a convention agreement, is what I've just been talking about. All this, building out laboratories and such. But the bigger issue I actually put together a whole webpage just to discuss it. And Meryl Nass has been, very much talking about this, as well as Professor Francis Boyle. What they should be negotiating, if they truly wanted to stop the next pandemic, would be a termination, a shutdown, make illegal gain of function research. Stop going into bat caves, pulling out whatever it is you think you can find so you can bring it into a lab and change it on the computer to make something that is more deadly that you then inject into people. That's a biological weapon. This is what they are actually pushing towards under the guise of, oh, well, we got to go look for the next pathogen. Well, I don't know too many people who are, off in a bat cave digging through guano, and getting a respiratory problem. There are people who do that, and they need to be careful. Right? You probably should wear a mask when you're doing that. But to go into all of these areas, to go into septic systems to see if you can find a new version of polio and bring it into the lab and work on it, it's insane. But they're presenting it as, oh, the next pandemic is going to come from animals. Well, yeah, if you go and take it from an animal, bring it into a lab, and make it more transmissible and more deadly, you're right. Stop doing that. Okay. And so the negotiations for what people call the pandemic treaty is not, right? It's a framework convention that would set up a bureaucracy called the Conference of the Parties, bunch of business leaders, bunch of foundation, people, the delegates from whatever nation sign on, and they just want to build out the infrastructure that I, think is conducive to biological warfare. And the biological warfare doesn't necessarily mean, some bomb is going to fall from the sky and there's going to be bacteria. It's coming in through your arm. If you're silly enough, to let them convince you that that's good for you.
And what about these international health regulations?
All right, now we get into the complicated part, as if that wasn't. There's multiple aspects to this, and so when I first found out about this, what I found was proposed amendments from the Biden administration that actually had, the whole push from this actually started, I believe, in 2020 with a minority report from the Republican Party in the House of Representatives. They advocated altering or amending the international health regulations to give more power to the WHO because they wanted to use the WHO to beat up on China. And so that was inherited by Biden. A year went by in his administration. There were negotiations after the second session of the World Health Assembly in November, December of 2021. And the Biden administration surprised probably many of the other nations. They got together some of the wealthier nations and they submitted these amendments. And all of the other nations are like, well, wait a minute, where's the equity? They just said, we want to change the international health regulations. We want money. We want equity. We want access to these wonderfully safe and effective medical countermeasures. And the Biden administration drops this set of amendments to shorten the time period that you could consider what was going on and put all kinds of, power into the hands of the WHO to declare not just a public health emergency of international concern, but a regional health emergency and an intermediate health alert and all these crazy. And all the other nations are going, that's not what we said we wanted. And they put the kibosh on it. And the negotiations continued, and I feel illegitimately at the last minute, a new set of amendments were adopted on May 27th, 2022. So just back in 2022, there's two versions. There's what Biden proposed, which mostly was kicked to the curb, and then this new set, which what he was trying to negotiate, and this is just, it's just two numbers, but it's so nefarious when you expand it. The way amendments are adopted and put into legally binding effect is not the way people think it should be. And I agree, it's not how it should be, but here's how it is. You get a whole bunch of unelected, delegates going to the WHO. They decide to change international law. It was really quite entertaining the way they did it in 2022. I've documented all of that. And it's assumed that every nation is just fine and dandy with that, unless the leader of your nation writes a letter to the WHO and says, no, no, thank you, not for us. Every other nation can follow the new rules, but we reject those new rules. We're going to stick with the old rules. Well, the main thing that the Biden administration was trying to change, and once you cut through all the clutter, you go, oh man, this is really evil. The current period to consider amendments, whether or not you want to reject them for your nation, is 18 months. So go back to May 27th, 2022. We're 16 plus months into that period of time and nobody's talking about it. You can see how it's just been invisible. December 1st is the deadline. If no national leader rejects those amendments, then every nation will have to abide by them. What Biden wanted to do was shorten that time period from 18 months down to 6 months.
Wow.
Now, there's no reason for that. It's not like there's some life-threatening something that would people would be saved by an amendment to the international health regulations. The reason they wanted to do that was if you go forward in time to May of 2024, if this new pile of amendments are to be adopted at that assembly, 6 months from the end of May would be maybe like December 1st of 2024, still within the Biden administration. They didn't want the 18 months to go to whomever may be president in 2025. The negotiations didn't work out so great for him, and it got pushed out to 10 months. So April 1st would be the deadline for any amendments that are adopted at this upcoming May 2024 assembly. So whomever may be president next year, 2025 rather, um, will have the power to reject the amendments. And so that is just absolutely nefarious. We've had this thing for since 1969. What's the rush of 18 down to 6 months? If you want to change some rules, just go ahead and change them. You can abide by them. Why do you want to make everybody make that decision so quickly? Other than he wanted to be the administration that got to, push it through.
Right. That
Oh,
makes a
and you
lot
know
of
what? We
sense.
haven't we haven't hit the high point. Okay, the high point was last week. Okay, now this is not about what happened last year. The deadline to reject what happened last year is December 1st, 2023. But well, I'm sure I turned that phone off. The amendments that are currently being negotiated, the deadline to submit this package of targeted amendments to require equity is the week of January 22 to 26 of 2024. I know a lot of strange numbers. In 2024, the deadline is January 22nd to the 26th because they must be submitted 4 months in advance of the May Assembly, which begins on May 27th. So last week, the working group on all these amendments dropped an enormous bombshell. They said, you know what? We're not getting along. We're not coming to agreement. We're not going to meet our deadline. And I was like, wow, that's the quiet part. I thought they would have said that in private, but they said it in their meetings. I've got it recorded. I've published it on, you know, my website. But then they proceeded to roll out Stephen Solomon, who is their lawyer, their legal counsel, and he went through all kinds of contortions after clearly reading the rule, Article 55. There's no wiggle room in it. It says if member nations want to submit amendments to the assembly, they shall do so 4 months in advance of the assembly. Shall means you must. But they're going to attempt to ignore the rules. They basically were plotting what their plan was. They know what the rules are, but they're plotting to just keep having meetings to negotiate all the way up to the last minute in May of 2024. Maybe they'll let us see what they're doing, maybe they won't, and then just drop it at the last minute and try to ram it through. And it's just blatantly um, ignoring the rules. Now, if they were honorable people, they would have said, "Hey, it's not working out. Not going to make our deadline. We'll keep working on it, but we'll have to do it next year." But no, they're trying to cheat.
And that happens all the time with these international negotiations when they want the extra time, right?
Well, if we allow them to do so, but I think that public outcry for the rule of law, or in this case, the rule of Article 55, shall submit 4 months in advance of the assembly. If they want to push the assembly back, right? Have the assembly in December. If you want to negotiate until um, May, and then 4 months from there, have your assembly. But that's what an honorable person would have done. They're trying to cheat, plain and simple.
So I think you started to lean towards this, and I think that's where we need to go now is a solution. So you're trying to call attention to this. You're trying to
Hmm.
lead a grassroots effort, getting people to
Hmm.
to speak out. So what can we do? What can we do at an individual level, or at our community level, or at national levels? What can be done to hold the people in power to account?
Well, it really starts with awareness because if you've ever walked into a room and there's a bunch of cockroaches, as soon as you turn the light on, boom, they're gone, right? And so that's what we're dealing with here. We're dealing with people who want to do things primarily in secret because if you saw what they were doing, you would oppose it. Now, the media is complicit, and most of the alternative media has just ignored this thing completely for 16 months. And if they've reported on it, they've gotten it wrong. And so the confusion and the lack of information, what I try to do is, it's kind of funny. They shorten it, they give it a nickname. I try to publish the missing information, and they want to call that misinformation. Well, I got news for you. It's their own darn documents. And so if it's misinformation, it's coming from you. But the point is, it's missing from the public discourse. And so step number one for everybody who's watching this video is just take the link to this video and share the daylights out of it as far and wide as you possibly can, because you could go to any one of your public servants, right? They're not your leaders. We the people are the leaders. They are our public servants. Ask them a simple question: are you aware that the international health regulations were amended on May 27th, 2022? Did you know that? Did you read them? Do you know what the changes were? Did you know that the deadline to reject them is December 1st, 2023? Um, have you said anything about it? Oh, you don't have the foggiest idea what's going on. Okay, great. Now you're aware. From this point forward, if you don't do anything, then you're ignorant of the situation. Doesn't mean you're stupid. It means you choose to ignore what's going on. Now, there's all kinds of distractions. There's many, many important things going on in the world. And that's what they hope happens. They have this system structured so that if they can distract you for 18 months, or maybe 6 months, or maybe 10 months, and you don't get riled up and tell your president or prime minister, no, we don't want that. You got to reject it. The people were cut out of the system when we joined. Okay. The power shifted from we the people and our representatives in Congress, and the president was given the power to name a delegate. And then when the international health regulations were put in 1969, there's no Senate approval for this. It's if the delegates say they want to make some changes and the president does not reject them, done deal, right? So the answer, in my view, is to exit the WHO. Now, as one example, this morning in Canada, I know your audience may not be primarily in Canada, but people all around the world know somebody who knows somebody who knows somebody in Canada. Um, they just put forth a parliamentary petition. I'm going to give a shout out to my friend Doug in Canada, who was the driving force behind this. You can go to canadianpetition.com. Now, I've written a whole article on it on my Substack, but canadianpetition.com basically says, look, here's what the UN and the WHO are doing. We, the people of Canada, want out. Now, I'm in California, and in the United States, I've been going even a step further. Uh, Andy Biggs, who's a representative from Arizona, uh, put forth the WHO Withdrawal Act, HR 79, in the House of Representatives. So far, we've gotten, I think, 52 members of Congress to sign on as co-sponsors. And so I could explain that bill in about 15 seconds. There's three parts. The president would be directed to tell the WHO we're giving up our membership, we're leaving. We would stop giving them money, and we would repeal the legislation from 1948 that got us involved in the first place. It's not a 1,000-page bill that you can't understand and you get to see after it's passed. It's a page and a half. And so if you go to exitthewho.com, you can see all the information. You can see all 52 members of Congress who have co sponsored it. Give them a phone call and you'll get their staff and just go, hey, thanks. The congressperson that you're working for, I agree with them on this. And then take the list of people who have co-sponsored it, the Congress people who have co-sponsored it, and go look at what's going on, in the upcoming primary, which is, half a year away. And anybody who's running for Congress or Senate or the presidency, go, do you support this? I don't see your name on here. I guess you must be a globalist. If you support that, maybe I can support you. But if you're wanting to give more power over my health to the WHO, I'm going to have to see who else is running. And so in the Senate, not one single senator at this point has just copied Andy Biggs's legislation and put it into the Senate as a companion measure. It'll have a different number, it'll be Senate bill, whatever. It's a page and a half. I think somebody could copy and paste and submit it into the Senate system so that we could then say to the senators, we want you to support that. Now, I'm under no illusion, okay? Biden would veto it in a heartbeat. This is a tool to identify who is on whose side, pun intended, I guess. And so for the next 13 months during this election, ask everybody running for president, ask everybody running for the Senate or the House, what is your opinion on this? Are you for what the WHO is doing? Ask them a couple of simple questions because the answers are really easy. Did you read the WHO CA plus? Oh, wait a minute. It's in limbo. So you can't support the process if you don't even know what the document says. Have you read the amendments to the international health regulations? The original ones are 197 pages. I put together a Cliff Notes booklet, if you're familiar with what that is, on stoptheamendments.com. I just got a letter from, or an email from somebody who yesterday was at a gun range and met up with the staff member for their senator. And they had a copy of the Cliff Notes and they said, hey, you got to read this. I want to hear back from you and the senator. You got to take action on this. This is doable on a grassroots level. People, step number one, I know it's confusing, so I give everybody my phone number, and it's blowing up, and I'll get back to you as soon as I can. But my phone number is 310-619-3055. If you go to stoptheamendments.com, you can see what the Cliff Notes version of it all is. I have yet to see anybody who's looked at this and said, "Oh yeah, this is great. We want this." Because what they're not negotiating, what they're not writing regulations for, that they're authorized to, are things like advertising and labeling. Those blank inserts? Well, there should be a regulation that says, you can't do that, right? And, Nuremberg trial and informed consent. That insert is the information, and if it's blank, you're committing a crime against humanity. They are empowered to write regulations for diagnostic and testing criteria. Well, anybody who knows anything about the PCR process knows that the whole testing fiasco was a scam. And they should, and they do have the authority to write regulations to make sure that biological products that are, in international trade are not contaminated. And so, the latest news, which isn't news, we've known this since the beginning. There's high levels of DNA circular plasmids, wrapped up in lipid nanoparticles in what's supposed to be an mRNA jab, along with activators that help that get into your DNA and change who you are. You'd be safer to go down to Skid Row in Los Angeles, roll up your sleeve, and ask some random person to stick a needle in your arm than you are going to a pharmacy or your doctor and asking for an mRNA injection that's, contaminated with DNA that's going to change the essence of who you are. Um, they should be writing regulations, but they're not. They're doing everything else under the sun to transfer money, to build out this infrastructure, to fearmonger people even harder. And we need to be aware. We need to speak out about it. Um, the peoplesdeclaration.com talks about the gain of function, and they should be negotiating a treaty to stop gain of function. And why are we bringing um, you know, pandemic pathogens with pandemic potential into laboratories to work on them to make them, more dangerous? It's just absolutely crazy. Everybody who learns about it says, "Oh hell no!" It's the silence and the lack of awareness that we need to work on. And thank you, for the opportunity to shed some light on it.
Well, thank you for all the work you've been doing to bring attention to this. Um, I just wanted to ask you as we close, what is the one message you'd like to leave our listeners with?
I created a little slogan because it came to me one day. We need to get out of the who and into the new, right? The WHO is a teardown. It cannot be rehabilitated, in my opinion. We all need to exit the who and dismantle it. Human beings have been on the planet for however long you believe. And up until 1948, we did quite fine without a World Health Organization, right? Individuals, men and women, along with whomever they may want to get advice from, need to be the people who are ultimately responsible for their health. Having a centralized, one size fits all, one health approach, to put the power to make decisions about my health into some bureaucrat, hands in Geneva, no, simply no.
Great place to stop. Thank you so much, James. It was a real pleasure to have you. Tell us, how can people find you? You mentioned a number of websites and your phone number, but what's the simplest way to get to you?
Um, On jamesroguski.substack.com, jamesroguski.substack.com is where everything I've been writing about this for the last year and a half is found. All of the various domain names just point to various articles because I've written a whole heck of a lot of stuff and it makes it easier to find them. But it's all on jamesroguski.substack.com. And my phone number is 310-619-3055. Send me a text message, WhatsApp, Telegram, Signal, whatever you want to use. Give me a phone call. Don't worry about the time of day. I'm almost 24/7 with this. Love to talk to you if you're interested in pushing back on this.
Thank you so much. We really, really appreciate it. And I hope you'll come back and keep us posted on how these negotiations are going.
I will. Thank you.
Thanks so much. So, friends, if you enjoyed what you saw today, please be sure to follow James and also follow us on Twitter at collapse_life. And like, subscribe, share, comment on this video. As James said, please share it far and wide so everyone can understand what's going on. That will help us all, and it will definitely help us here at Collapse Life. So we really appreciate it. We are also on Substack, collapselife.substack.com. We publish new stories every week, so we really hope you'll join us there. And if you like what you see, subscribe, support us. We really appreciate it. We are totally viewer and reader supported. We're doing this to try to open people's eyes and help them understand what's going on in the world. And we can only do it because of followers like you. So we really appreciate the support. We've dubbed Collapse Life the thinking person's guide to society in demise. It's all about opening people's eyes, taking control, and taking action in our lives, just like what James laid out for us today. And we really look forward to bringing more engaging, intelligent voices like James's. And we can't wait to see you on our next podcast. And until then, remember to keep your chin up. It's only collapse. See you soon.